The World Health Organization has raised its risk assessment to very high in the Democratic Republic of the Congo as a deadly Ebola outbreak continues to spread in the region and into Uganda. Health officials say this outbreak involves a rare strain of the virus, one for which there is currently no approved vaccine or cure. The United States has already imposed restrictions on some travelers from affected areas, and here in Canada, airports have increased screening measures for travelers as well. Joining us now is Dr. Joanne Liu, Director of the Pandemic and Emergency Readiness Lab at McGill University, to discuss the latest developments in the outbreak and how Canadian officials are responding so far. Thank you so much for your time today, Dr. Liu.
Good day.
So, Doctor, this outbreak involves a rare strain of the virus. What makes this particular strain more challenging for health officials?
So right now in DRC, Democratic Republic of Congo, in the province of Ituri, we have an outbreak of Ebola disease, of the Bundibugyo virus. And what makes it very challenging, it's the virus in itself, because we don't have specific treatment nor specific vaccine. But the other thing as well is the fact that of the I would say the ecosystem in which it's happening, by the fact that it's happening in Montreal, the epicenter of the outbreak, which is a mining city where the population is mobile. So if we say mobile population, we say the virus is moving as well. It's at the intersection of three countries: Uganda, Democratic Republic of Congo, and South Sudan. It is in a place where there are armed groups that are disputing the resources of the mines and therefore creating movement of population and insecurity. We talk about more than a million internally displaced population. That's what makes it very, very tricky at this stage.
Okay, let's talk about the U.S. and Canada trying to contain this now. The U.S. has moved to tighten restrictions on some travelers from affected regions. As we know, Canada has introduced screening measures at airports, but should Canada be considering similar measures to the U.S.?
So that's a very good question. And what is the U.S. has done so far is something that is not recommended by the World Health Organization, the WHO, nor by the International Health Regulation. What we are saying is you need to enhance what you do in terms of screening at the exit of the country that is affected. So it's very important that in Democratic Republic of Congo that we are enhancing questionnaire and screening of people who are traveling, making sure that anyone who has a contact with someone who's infected is doing a 21 days quarantine. This is where you need to put strengthened measure. And the other best way to avoid to have cases in Canada or in North America is to make sure that we are beefing up the response in DRC. And that means that we should help them as much as possible. The best way to not have cases here is to make sure that we are controlling it where it is happening right now.
Okay, and how prepared is Canada's healthcare system to identify and contain a suspected Ebola case if it does end up here?
So another very good question. And I think that we went through that kind of exercise in 2014, 2016 in the historical outbreak in West Africa, when there were more than 28,000 people infected, 11,000 people who died. And then we had protocols for that. And we have to remember that back then, a lot of Canadians went and work in West Africa and care for patients. And all of us, I was one of them, we came back here, we did our quarantine, and we followed the public health measure, and no one was infected. So the other, I think, point of reference as well is in 2014, 2016, all the cases who were repatriated or developed in a country because of some traveler, none in Canada, only in the States, it all stopped at the patient, and only at one instance there were like 2 nurses who were infected. So with our prevention of infection measure here, we're able to contain this very, very quickly. So I'm not concerned about the Canadian, and the risk is very, very minimal. I'm much more concerned about Congo and the neighboring countries, South Sudan and Uganda.
Okay, and with Toronto preparing to host World Cup matches, does the expected increase in international travel change the risk level for us here in Canada at all?
Well, I think it's the same the same answer in terms of we need to make sure that at the exit of the country of where you have cases, which is Democratic Republic of Congo and Uganda, that there is enhanced measure of screening and questioning of people who are traveling, and we have to remind yourself that to get infected, you need to be in direct contact of the body fluids of someone who's infected, which is his blood or his saliva or other dejection. So it's not transmitted by air and then by like casual touch. So this is why it's unlikely to have any big, I would say, propagation in other countries and while traveling like this, because people are screened, and then you're only contagious if you have symptoms. So this is why at the exit of a country that is affected, good measure of screening is what is key.
I feel like you sort of answered the last question I'm about to ask you, but if you have a different answer, I want to ask you anyways. Finally, what do you think is the biggest misconception people have about Ebola? And what's, the most important thing Canadians should understand about this outbreak?
Well, I think the misconception is more on the fact that is it the next pandemic? Very, very unlikely. Because of the mode of transmission, because it's direct contact with body fluids of someone infected. When we have, I would say, more of the risk of a pandemic, it's when it's transmitted by air, which is not the case. So I think that Canadians can be calm about that. I think that the best way and to get the best outcome is to make sure that the Democratic Republic of Congo got all the means and resources to respond to this outbreak.
Thank you, Dr. Liu, for your time and insight today.
Thank you very much.
That is Dr. Joanne Liu, Director of the Pandemic and Emergency Readiness Lab at McGill University.